So good afternoon and welcome to another edition of A Chat with Caroline. Just a reminder to use the chat facility on the screen on the right hand side to ask any questions you may have of the panel this afternoon. I had a few questions in already which we will relay to Caroline over the course of the next 15 or 20 minutes. Thank you, Caroline. Over to you.
Thank you very much. So welcome everybody and thanks ever so much for joining us with this Chat with Caroline. Today we're going to be talking about the development of our clinical strategy. Really important that our clinical strategy is at the heart of all of our strategies, so it's the first one we're going to be developing. I'm just going to introduce the team, or ask them to introduce themselves, and then I'm just going to give an update before we come back and discuss the strategy. So Mark, would you mind just introducing yourself and then we go round, please?
Yeah, Mark Worthington, Acting Deputy Medical Director.
Laura G, Modern Matron for Children's Complex Needs Nursing Services.
Hi, I'm Richard Morgan. I'm the Acting Medical Director and the Executive Sponsor for the Clinical Strategy.
And I'm Paul Bibby. I'm Head of Strategy and Planning for the Trust.
Okay, thanks ever so much, and we'll come back and be having a chat about the clinical strategy. Just a few minutes update, as usual, of the key things that are happening or are going to happen, if that's okay, folks. First is, we've been just thinking in the last week or so around the scale of change and the scale of ask that we're asking people to step into, and really aware of the impact that is having for people. So there's a lot of improvement that's going on, there's a lot of change that's going on. Our staff on the front line are doing the most amazing job, and particularly in our mental health services we are seeing some significant improvements that can only be achieved by the commitment and motivation. So it's a really big thank you to everybody, and a recognition that we understand that there's a significant change programme going on across the Trust. One of those is, of course, the locality change programme, and as looking in a very, very co-produced way, what sort of structure would enable us to deliver the best possible care to our service users going forward. So in the last week or so, we've started another round of locality workshops, and particularly asking this time around what sort of leadership models would make sense, and just to play back to people the clinical structures that most people have, we've got a majority view coming forward. So just a reminder to just do engage in that if you're not already booked on, and thank you to everybody who's been involved in that. A couple of pleas, a really big plea. We've only got 48 hours left to complete our staff survey. Friday is our cut-off time. It will be great to have the biggest possible response we could get. Understand it's time out for people. We are asking each of the teams to make sure that people have some protected time to complete that survey. So if you do have time, really important that we hear your views, then we can continue to improve working lives for all of our staff. And then another big plea, and again a big thank you to everybody who's already had their flu jab. Again, just a few minutes out of either clinical practice or your wider working environment to just have your flu jab. Really important. We have had a couple of flu outbreaks this week on a couple of our wards, and it's a big reminder to us around the real importance of having our flu jab. So please have it yourself or encourage teams around you to do the same. Really delighted that we've now able to announce that Ken Levins has been appointed as our Freedom to Speak Up Guardian. This is the first time that we've got a dedicated full-time role to speaking up and speaking out. Really important, and we'll build on all the work that's been done to date, and we'll be there to support the Freedom to Speak Up champions and be part of our culture as we go forward to be as open and transparent as we can. So well done to Ken, a great appointment, and I'm sure he'll be out and about chatting to people. We've got a whole list of awards that people have been shortlisted for, so really well done. So 3 of our teams have been shortlisted for the NHS Elect Awards, Central Manchester Moving Well, our Blackburn with Darwin Pulmonary Rehab team, and the Seclusion Continuous Improvement Group. So really well done to you guys. We've also got our procurement team who've been honoured in the Northern Excellence in Supply Award, well done. And also our medical education team who've come second in the North West region for supporting medical students out of I think about 13 trusts. So really well done to you all, really important. And then just a couple more. We have now been able to announce the start of our new communications director. One of the key themes that I've heard pretty consistently since I've joined is we need to communicate more. So really delighted that Shelley Wright will be joining us at the beginning of January. She comes with a really strong background in comms with both the public and private sector. I know she'll be out and about meeting people early in the new year, so I'm sure you'll give her a warm welcome. And then finally, we held, I think only this week, the open space event. I think it was on Monday, wasn't it? Which was a really important event with our service users and carers, where it's a very much, again, building on the good work we've done to date and starting to co-producing and engaging with service users and carers in a different way going forward. And it's the start of many events and work to come. So again, thank you to everybody who's been involved in that. And of course, service users and carers are really important in terms of the development of our clinical strategy. So I'll maybe ask Richard to start off as the lead executive for the development of this, just talking to us about why we need this. Why do we need to spend time developing a clinical strategy?
Okay, thank you, Caroline. It's a really important point, and slightly to my surprise, we've not actually had a clinical strategy before. So I guess the key thing about this for me is ensuring that the clinical strategy becomes actually meaningful. Yeah. So we'll produce a document about at the end. It'll be hopefully nice and shiny and all that sort of stuff. But we don't want it to be just left on a shelf. Yes. So it's got to actually have meaning to people. A couple of the other key principles around it are that we don't want it to be just top down. So we don't want it to be sort of exec driven, and that's I guess how we've been conducting the development of it. It's not yet developed, it's not all sorted out, but we've engaged with a lot of staff, which Paul's been sort of helping to organise. And so what we want is staff, service users, carers, and other stakeholders, so GPs, etc., to let us know what they think is going to be most important, because this will actually shape how we deliver our services over the next 5 years. Yeah. And so if this is developed by our own staff that actually deliver the care, and they decide what principles will determine what services we deliver, as importantly, how we deliver them, then I think that will really engage people, and we'll end up producing better services in the end. So the principles, which Mark's going to talk to in a minute about, so we've got a starter for 17 principles.
Not for 10.
They'll be shaped a little bit more yet. So that'll be really valuable to us, and we've had to make some starting assumptions of what we want. Key areas of priority, so there's sort of stuff around the locality, stuff about the adult acute pathways, rehabilitation, that sort of stuff about children's and young people, stuff around the learning disability, community physical health services, and then specialist services. So it's
been really broad and encompassing
broad.
of lots of different services.
Yeah, absolutely.
Okay, and it's really helpful to say this is the first clinical strategy we've had, so really important and important that people are really engaged in that. Paul, do you just want to tell us a little bit about what process we've used?
Yeah, sure.
And who we've engaged today?
Yeah, so we've based our approach on a methodology that was published by NHSI, or Monitor as it was back then in 2015, but we've adapted that to meet our needs. But essentially, the approach that we've taken is, first of all, it's been really important to understand the context within which we're operating, and we've done that on 3 levels. So we've looked at nationally what's going on across the country in terms of health, and clearly the long-term plan is heavily featured as part of that. We've also looked at what's going on locally across the local health and care system, or the ICS, the integrated care system. We've been looking at what partners are planning to do, but perhaps more importantly, we've been looking at the needs and the wants of the local population as well. So that's what we've been doing at that local level. And then thirdly, we've been looking at ourselves as an organisation and how we've performed. And we've had lots of pointers for that. As we know, we've had the outcome of the CQC inspection, we've had the NTW review into our urgent care pathway. So as well as the data that we generate ourselves, we've also had that external scrutiny on where we are as an organisation. And I guess put simply, the planning process then is kind of our baseline and our starting point. And as Richard has already said, we've started to articulate what we think that future position looks like. And coming out of the strategy, there will be a delivery plan, and that essentially will articulate then how we get from where we are now to where we need to be in 3 and 5 years' time.
I was just going to add, which I forgot to mention before, that a very important point is that the clinical strategy is going to be the foundation stone for all of our other strategies. So out of the clinical strategy will fall out the quality strategy, the estate strategy, our digital strategy, etc. So it'll be the starting point for
It'll
all
be
of
the
those.
centrepiece
Yes,
of all the others,
exactly.
and how they respond
Yeah,
to that.
absolutely.
Yeah.
Absolutely.
The golden nugget.
Yeah.
Okay, Mark, let's hear from you around what are these 17 starters for 10?
Oh, well, I think a lot of them won't come as a surprise to frontline staff. So some of the top things are about patients not having to go through repeated assessments. So they have one assessment, they don't fall between the gaps between services. More focus on prevention in line with a long-term plan, early intervention, education, putting people more in control of their own health and managing, taking responsibility for that. Appropriately staffed and skilled workforce, that's another big one. And one of the things that's come out is staff having access to regular supervision, and I think that was something that came through in some of the previous CQC comments as well, isn't it? So that seamless service delivery. One of the things that I'm particularly keen about, and I know Richard is better use of data, because we're not very good at measuring patient outcomes, and we've got to really demonstrate the quality of our services. So that's one thing we need to work on. Just our services being more responsible, flexible, better communication with patients, carers, GPs, better environments, supportive environments, making sure that staff have the necessary equipment and time, and we have enough workforce as well. So I think that kind of gives a summary of the key principles.
And just talk a little bit about multidisciplinary team working. Did that come out as a priority for people?
It did.
Yes.
It certainly came up there. And one of the things, so multidisciplinary team working, obviously essential, and I think there's just everyone's in agreement with about that. But what also came forward was some of the new roles that we're going to need to develop. So there's stuff around recruitment, there's about having the right people at the right time, but we will need to develop new roles, and some of those will be quite attractive. So that came out in the conversation.
Yeah, and I guess underpinning that multidisciplinary working, there was a real desire amongst the clinical staff to see more seamless service delivery, whether that's across the trust or with partner organisations.
Yes,
Yeah.
excellent. So Laura, let's hear from the front line. What does it feel like?
I attended one of the Engage events, and it was really good that it was actually all community based. So very much services that are also experiencing similar issues, if you will, but also the fact that we can influence the clinical strategy rather than it being, like you talked about, executive down, that it is actually clinically led.
Yeah.
And we worked on our table about what things we're actually doing already and how they fit quite nicely within the clinical strategy. So at the moment, within special school nursing, because of the SEND inspection 2017, we're looking at a standardisation across the whole of Lancashire of the offer that special school nursing offer, and working with the CCGs and other providers.
So I guess a big key part of that will be working in partnership with other providers.
Other providers,
Yeah.
the education and the CCGs.
Yeah. So but that presumably is a key principle that
It absolutely
that
was.
came out as a theme.
Yeah, partnership
Yeah.
working, and that's. There are various ways that you can categorise things. So within the prevention sort of area, there was an awful lot of talk about the partnership working, because I think we're going to clearly the demand is very high into services. It's going to only increase, so we're going to have to do a lot of preventative work in order to be able to deliver the services we need to in the future. And partnership working will be key for the preventative work as well as the work that we're commissioned to do.
Yeah, sure.
I think social prescribing and link workers and peer support workers has been one of the things that's been talked about as well.
I think that was another fairly strong message, wasn't it, about and in terms of workforce and developing our services alongside services users, carers, peer support workers, as you said. I think it's going to be crucial.
Really, really important. So have we got any questions that have come through?
Yes, we do have, Caroline. Lisa would like to know, how can I have my say on the development of the clinical strategy?
Really important. Paul, are you taking that one?
Yeah, so we've got an online platform that we've established called TriSider. There is a link to that online platform on everyone's desktop now, so there will be an icon on there that people can click on that will take you straight to that online platform. You don't need to register to take part in the conversation. You can just comment, and people have started to do that already. And you can also vote for the principles that you think are the most important. The link is also available as well on the intranet page. It's got pride of place in the centre there, so you can. It's not hard to find. You can click on that, and again, that'll take you straight to the online platform.
It's just the clinical strategy. It says clinical strategy, doesn't it, on the landing page on the intranet?
Yeah.
And you click on the link
Yeah.
and you go there. I've used it. Yeah.
And are we having another event in January to
We
engage
are.
people again, Richard?
Yeah. So we've got various bits that we need to do yet. So we need to do some more service user engagement. We need to do some more engagement with some other external stakeholders. We think we'll have got the broad principles largely agreed, and then we're going to engage again in January, and that's feeding back to all of the staff that wish to attend and external stakeholders, and then we'll present where we've got to, and what we're expecting and hoping is that's going to be finessing it.
Yes.
I hope there aren't going to be major surprises coming out at that point. If they are, then they are, but
Yes.
that's going to be our major presentation.
Excellent.
And Tony would also like to know, to what extent is our clinical strategy going to be driven by national and local priorities?
It's presumably it's going to be right at the heart of national and local priorities as you started. Paul, I don't know if there's anything else you want to say around that.
No, I mean, there are some must-dos that we have to deliver in line with that national guidance, but I think at that kind of local level, it isn't just about us following the lead of the integrated care system. It's about us influencing that as well, and working with partners about what we think we need to deliver high quality services in the services that we deliver. Yeah.
So there's very clear strategy nationally for mental health now, isn't there? With the investments for mental health being very in detail set out, really quite a granular level. So presumably that'll form part of the mental health element, and again on the physical health element, there'll be some direction of travel, but an ability to influence that.
Yeah.
And then we've got 4/5 ICPs and MCP that are developing their own priorities, and we've got the ICS strategy as well.
Yeah.
So it's quite a feat to pull it all in together, and really important why we engage with people and make sure that we've got all the strands connected.
It is, and we're meeting with, we're going out to meet with the ICPs, we're also meeting with the ICS, and some of us have been to the clinical congress with the ICS held about developing parts of their strategy, and it's interesting to hear how some of the themes are, I guess not surprisingly, are similar, particularly the prevention theme, I think.
Yeah, indeed.
And actually leads on nicely to Helen's question, how are we aligning our clinical strategy with the broader ICS agenda?
So I think we've probably just answered that. Yes.
Obviously
Is there any other final questions at all?
As you would imagine, elections around the corner, so I think people are just wondering if there's any delay in the current plans that you may have because of that.
I don't anticipate at all that there'll be any delay. I think it's really important that we listen to our staff, service users and carers and our partners around people's ambition for the future, regardless of an election. And we won't be publishing the strategy till well after the election.
That's right.
So I don't know if anybody else anticipates any changes.
Any changes, no.
No. Okay, so thank you, folks. As always, keep your questions coming. We will always continue to answer them. And just a reminder that our next chat with Caroline on the 12th of December is on a really important area of safety, and that's safety from a service user and a staff's point of view. So please pop it in your diaries and join the chat, and obviously let us know what questions you've got, if you can, beforehand or during the chat. Thanks ever so much, and thank you very much indeed.
Thank you.
Thank you.
Thank you.